think they're behind the times in terms of what's getting done.
A lot of time.
Meetings of the Johnson County Board of Supervisors are open to the public and are generally live streamed. To join electronically, please visit bit.ly/JOCO meeting. Written comments may be submitted to sups@johnsoncountyiowa.gov. If you require accommodations to participate, please contact the board office at 319-356-6000 prior to the meeting. Public comment is at the discretion of the chairperson. Comments should be limited to 3 minutes. Due to public meeting laws, the board may only discuss or act on matters presented on this agenda. Welcome.
Call this meeting to order, 3:30, and the first item on our agenda is public comment. Is there anybody in the audience who would like to speak to an item not on the agenda? Anybody in the audience here for public comment? Okay. Item B, presentation of research findings from the Prison Policy Institute and Prairie Lands Analysis of Applicability to Johnson County by Elizabeth Ruth Panacucci, co-director of Prairie Lands Freedom Fund. Elizabeth, you just want to come up here, and we also have this in the packet. Please.
Oh, great. Hi, I'm Elizabeth Ruth Panacucci. I am, as V said, one of the volunteers. So I'm a volunteer staff member of Prairie Land Freedom Fund. We're an all volunteer run organization. And I have on the Zoom call, I have two people from the Prison Policy Institute, Sarah and Emmett. So they're available for questions as well, and their research that has been submitted. I believe they'll be able to unmute themselves when the time comes to participate in our conversation as well. I'm going to start talking just a tiny bit about PFF and PI, Prairie Lands Freedom Fund, and Prison Policy Institute. And then I'm really going to be presenting some data from PPI and a conversation around how we can work together to have this committee write what it would be a passable bond measure in our community for the new jail. Okay. So Prairie Lands Freedom Fund, we are a nonprofit grassroots organization based in Johnson County, Iowa. We've existed since 2016. So for coming up on 10 years, we have been paying bonds and bail in our community. What that means is we focus primarily on immigration bonds, but we have also paid pretrial bail. And what that means is right after a judge sets a bonds amount, if the person is still incarcerated, they are incarcerated simply because of their poverty. Prairie Lands intervenes to allow that person to come out by paying their bond, reuniting them with their family, restoring them back to their community, and allowing them to proceed through the rest of their either immigration case or pretrial case, not incarcerated. We have been doing this, as I said, for coming up on 10 years. We have posted over $2 million worth of bonds, and we have reunited almost 400 families. We focus primarily on immigration, but have paid on both sides. And we have really established ourselves as a voice in the community, as a leading voice on immigration and incarceration. And we see that in our community supports, our kind of asks for community support. The Johnson County community is with us in our work. The Prison Policy Initiative is a nonprofit, nonpartisan organization. They conduct research and they specialize in researching jails needs assessments. They've done this in communities throughout the country. And they looked at the jail needs assessment from our community and our local data. They came to the conclusion that is shared with Prairie Lands Freedom Fund that I want to communicate to this committee today, which is that we do not need to increase our jailed population. We do not need to expand our beds. That is not what community safety looks like, and that is not what Johnson County needs. So let's get into it. Research in our local community and across the country shows it's well documented that pretrial incarceration harms communities. We see this at the individual level with data like this. And then we also see it on the next slide at the community level.
Good question.
It says the report. Which report is this
It would be the
referring
CHAG report.
to?
This
Is this, so when it says the report, page 14?
Yep.
It's
You-
referring to the Shive report?
It's referring to the prison policy initiatives report, which should also have been submitted. I can follow up with that.
No,
It's
it's not
Yeah.
submitted.
All we have is this.
Okay,
Oh, that's right. Yeah.
And I looked online and I couldn't find what report it was, so.
I can find out for that. Sorry, their report is commenting on the shift, so.
Yeah, it would be good to
that's
see
right, the
that.
prison policy. The page numbers that are cited are from the PPI report, though. I apologize, it didn't make it into the agenda. We can follow up.
Yeah.
With that for drop down details. We also have the researchers on the call for follow-up conversations live, and will kind of welcome any follow-up conversations individually as well. So we see through local data, through national data, that pretrial incarceration increases harm to individuals who are incarcerated. The longer that they're incarcerated, the further we see these harms done. The data is clear on that. There is a prevailing logic in our community, and I think throughout our country, that bigger jails, more incarceration means a safer community. However, that's not what the data shows. That's not what our local data shows, and it's not what national data shows. What is true is smaller jails with strategic releases that also rely on good, solid funding towards community supports. That's how you increase community safety, not by expanding a jail population. We also see that pretrial incarceration hurts our community at large. In summary on this slide, when people are incarcerated pretrial, it increases their instability, which is not safe for anyone in our community, causes instability throughout our community. This is why PFF exists. This is why we have paid over $2 million worth of bonds, is to increase stability in our community. And we have seen that the Johnson County community shows up and supports our work, that the Johnson County community understands this as well. That keeping people incarcerated is not the answer, but rather allowing people to be in our community, embedded in our support systems, is how we experience community safety together. We have seen, there's this, another kind of prevailing piece of, a narrative that, we need more beds for more mental health care. However, incarcerating people does not address the underlying conditions and the needs for supports in a mental health crisis or substance abuse crisis or homelessness crisis. The answer is not to incarcerate people and expand our incarceration. The answer is to fund our community supports. We have to direct our tax dollars in that direction, not in the expansion direction.
Before you leave that. I don't have any numbers for sure, but I think the guidance center cost $10 million. Again, I don't have those numbers.
I think that this is the ongoing, that's maybe the starting cost of GuideLink, but this is referring to the ongoing money directed towards GuideLink. But I can, maybe if Sarah and Emmett are on and can hear and know where that comes from, we can look at where that 12 times the amount spent is coming from.
So you're saying 5.5 million is the operating cost for beds?
For a quarter of the proposed beds that are targeting for mental health.
I guess, and tell me how you came to that number. I'm curious, what's the,
The
walk me
which
through the
number?
math, the 5.5 million for the beds, like,
Yep, for that, I need to go to Emmett or Sarah for them, how the math was arrived at. You're able to jump in.
Hello, folks. Hi. So sure, I'm happy to do so. So we looked at the square footage. So the square footage was estimated to be about $752 per square foot. 7,500 square feet were dedicated to mental health, for mental health beds, for mental health bed space. And so we just took those numbers right there.
yeah, it gets to a point.
Excuse me?
I think there was something else.
I think there's just crosstalk on your call. Go ahead, Emmett.
Oh, I'm sorry. I was just that way. So it is about a quarter of the beds that are dedicated for mental health beds. But when we look, I think it's hey, I can find the page if you need it, but the square footage for cost for the project is estimated to be about $752 per square foot. 7,500 square feet are dedicated to those mental health beds right there. And so when we put those together, we come up with about 5.6 million actually.
Not an operation cost. So,
The building comes.
Yeah, those are construction costs.
We can come back. I don't want to belabor getting through this. Go ahead. We'll come back.
So I hear you, Rod, that that's an apples to oranges comparison. Yeah, I hear you, that that's an apples to oranges comparison. The point still, the point of the slide. You are right. That's an inappropriate comparison. The point of the slide is that incarcerating people with mental health needs does not increase the safety and does not give people with mental health needs the support that they need. Instead, we can direct funds to, instead of increasing beds to incarcerate people with mental health, substance abuse, chronic homelessness needs, we can instead pour that into our community for true sustainable supports. We can also get an updated number on that. Yeah. Our local data does not support expansion. So there are a lot of numbers on here. In general, the concept on this slide is, and we can totally dig into these numbers, and I agree, we need the full reports to be able to look at them more fully in the context and be able to clearly articulate where they come from. But in general, by every metric, our jail population is decreasing, including our transportation cost for sending people to other jails when we are at capacity. All of our metrics are showing that we are decreasing our jail population. I also want to point out, this is not a blip because of the pandemic. This has been seen regardless of 2020 and 2021, that our metrics are decreasing. It seems as though the numbers that were used in the needs assessment for the projection of beds were more based off of our county growth. Our county population growth has been increasing. And so the logic that seems to have been used in the needs assessment, because it weighed 40% of the jail population projection from our county growth, was that if our county is growing, our jail must grow too. We are rejecting that logic and saying that is not true with what we've seen in Johnson County. We have seen our population grow and our jail population decrease, our crime rates decrease. And so the idea that we must have more beds is not logical. That is not the actual conclusion that the data brings us to. The data is showing us that we are decreasing and we have a sustainable number of beds in our current jail population. I have two more points to make. And to me, this is the point that I care about the most and the point that I think our community cares about the most. If we expand our jail beyond our capacity and our current incarceration rate, we will open our community up to expanded risks, particularly a risk of increased ICE activity and increased local deportation. We have seen this in every community that expands their jail. ICE takes the beds. We see that in Polk County. We see that is what happens when the jail expands beyond the community's true needs for incarceration. ICE takes the beds, they place ICE holds, it increases ICE activity within our local community and makes our immigrant community vulnerable for deportation. That is an unacceptable consequence to a jail that needs to be rebuilt. We need to pass this bond because our jail's current state is unacceptable. But we need a bond that does not increase risk to other members of our community, particularly in 2025, that does not increase fear of deportation in our local community. We also see that we have racial disparities in our jail. Those racial disparities are not accounted for in the jail needs assessment, and how an increase in the population will not increase this disparity. It is a real risk to vulnerable populations to increase our capacity to incarcerate and then disproportionately incarcerate Black and brown bodies in our community. That is also an unacceptable risk if we have a bond that includes increasing our capacity. We do have to prioritize the health, safety, and well-being of every member of our community, and that means building a new, clean, safe jail. Our jail conditions are unacceptable. However, we cannot have a bond measure that increases the capacity. And I believe that every member of Johnson County will understand that if we have a bond measure that comes to ballot that increases capacity and therefore increases risk, particularly the risk of deportation, that bond will not pass. And I want to vote for a new, clean, safe jail. I want that for members of my community, and I will not vote for an expanded capacity that makes the immigrant community more vulnerable to ICE activity. I'm sorry for my emotions. Actually, I'm not sorry for my emotions. I run a phone line. I'm a part of a team that runs a phone line that our immigrant neighbors can call when they suspect ICE activity. And it's been a hard 3 months. I don't want any messaging to our community that could at all be seen that we are increasing ICE activity or cooperating with ICE in any way. That is just an unacceptable message to be sending to a very, very traumatized community in Johnson County. I hope that this community will take these recommendations seriously and not send that message in our community. I'm supposed to let you ask me questions, but I need 1 second.
Yeah, no, thank you, so much, Elizabeth, and definitely take a moment to let yourself, while you're doing that, I noticed that Ashley had her hand raised, and I apologize, Ashley, if that's your hand raised until, what I was told, so I don't know if you wanna unmute, and provide comments, and then we can kind of open this up for more questions. And thank you also, Elizabeth, for your presentation. Thanks.
Ashley did post a comment in the chat that I can read if she doesn't come off, but it was about the guide link point. And then,
Oh, right, yes.
Yeah.
Also wanted to note that I sent to Paige the report, and my apologies, that was like a long time ago request, and I just thought that it was in the packet. I did not catch that. So hopefully you all will see that in your inbox. We'll get that added.
Thank you for that.
Yeah. Yeah, so Ashley, I guess if you could hear us, go ahead and unmute or use the chat, and we'll give you one. Did she? Oh, there's a chat happening. You want to read the chat?
I'll go ahead. She's having microphone issues,
Oh,
but basically her
oh,
comment,
okay.
if you would like, you want me to go ahead and read her comment?
Yeah, go ahead.
I'm sorry. It is worth mentioning that there is sufficient amount of funding going towards GLC, which I assume is GuideLink Center, from the county on top of state funding and other funding. And she sent that about the point that you guys were talking about GuideLink.
Yeah.
Everything else, I think. But yes, the comparison of this bond versus what is being provided to community services.
We can get one.
Hopefully she'll get
I
fixed here.
She also got drunk.
Okay.
But yeah, I appreciate those comments. So I wanted to open this up to the committee for questions, comments. I know there were some that were already answered. And,
I got some questions. First of all, Elizabeth, thank you for your passion and taking care of people. I agree that what's going on today is today and not fun, but hopefully a little change in the future. And that's what this jail is for. It's for the future. I'm having a hard time in my head figuring out a building, how does that affect incarcerations when it's the laws that affect that? And this is just a building. We need the space, so we don't send people to other counties. I would rather have us spend more time on changing the laws and the attitudes of people. So this is just a building. And I don't know how, if we build less beds or more beds or hardly any beds, that will affect what's happening now with the different laws and incarceration. I don't know of any cop who says, well, we got no room, we're not going to arrest you, even though you might have just robbed a bank or something. That's why I'm having a hard time, but I
Yeah.
agree with you. We need to
I
have
think
more
it's the
funding.
opposite that is the fear,
What's that?
I think it's the opposite that is the fear is, we know what to do when we're at capacity, but when we have extra beds that are sitting and unused, and then, that, how do those get, it's a supply and demand issue, right? And as we increase the supply, then the natural tendency that is seen across data across the country is to increase the demand, or maybe the beds are the demand. In that analogy.
I don't get it. That doesn't make sense. That's not logical.
Well, comment on that?
Yeah, please.
So when we look at, I'm gonna extrapolate a little bit, when we look at health economics, and looking at cost of medical care, we know that when, say, an emergency room gets a new CAT scan, you are way more likely to get a CAT scan if you come in for a number of things. And so supply does drive demand, and that leads to increased costs. And so I think it's the same thing when you more lanes on the highway, people are more likely to drive, so it actually increases traffic. So I hear sort of the same thing, that we have extra beds, people are gonna use them. And I wonder if I could also just share, two stories about that happened in this past week. One of them is a friend of mine, has been in recovery from a substance use disorder for 5 years. And she was present at an overdose 8 years ago and called 911 and was issued a ticket for being present where there was paraphernalia. And did not realize that she also had a court date. And so she was in the line at a fast food restaurant here in town earlier this week, getting dinner for her son. And she got pulled over by a cop and was arrested, and then was taken out of county to a different jail, and spent the night in jail for missing a court date 8 years ago. So they had her address, she never got a letter about it, but it seemed like using incarceration to address this just didn't feel like the right fit for what happened to her. And then another thing that happened to me this week is one of my former residents who works in another part of Iowa, in rural Iowa, called me for advice because a patient of hers had her first manic episode, she's a college student elsewhere, had first manic episode and was in the county jail there. And she was trying to figure out how to get this person moved from the jail to the hospital because she needed medical treatment, but they didn't want to let her out of the jail, and she was having problems trying to figure out with the court to get her moved from the jail to the hospital because she needed medical care. And I just feel like both of those stories would illustrate when we have capacity, when a jail space is a place to put somebody, people get put there. Then these are two, they're not exactly what we're talking about, but I do think when we have, I think there's a lot of evidence that we have capacity for things to use them. And so I just think we need to be thoughtful about that.
And then
Those are my
also,
advice.
And
Also-
I do appreciate that.
There was
Those
one
are
more
heartbreaking stories. I'm just having a hard time seeing how the cops are gonna have a quota system to fill the beds up. I don't get that. I mean,
Well-
this is just a building.
Intentional like that at all.
and I don't think it's necessarily about our law enforcement agents either, like Elizabeth was talking about federal agencies,
Sure.
right? They're gonna look for what jails around, when they're intending to increase ICE activity, we may not have any control over what happens with that federal policy. But they're gonna look for communities that have the space to put people. And if we create that space, then we will become one of those communities, and that's where we get the increased.
I guess I'm
That makes
about the ICE, are
Time
you talking about people like a jail that houses ICE detainees?
But I think that's what
Because
she's
that would be
referring
up to
to
the Board of
happening in
Supervisors.
other places.
That would,
yeah.
that would be up to the Board of Supervisors to approve the beds. That's not something that just happens. ICE doesn't just go around it.
We are setting ourselves up to walk down that path.
So Elizabeth, obviously I disagree with a lot of, in general, right, like a lot of the conclusions. But where I think I take the most issue, and I think we're talking about, is this particular topic. First of all, I don't think there's any evidence to suggest that if we add more beds, then they will either be filled by local law enforcement in general, or that ICE will see an opportunity to put people there. Two, they can't just show up and say, we've picked up 5 people, we want you to take them. The only time we house them is when they are here for a local charge. And then immigration puts a detainer on them. And we maybe have, I don't know, half a dozen in custody right now who have a pending local charge, like a lot of times like sex abuse, domestic violence, something along those lines. then they put that detainer on the person. Once they're done with that local charge, whenever it may be, maybe it's disposed of in 30 days or 280 days, I have no idea. Then when that's done, then they go into their custody. But the notion that we're adding more means then we're now going to contract with ICE to take those beds, like, I'm not interested in doing that, and that would require an agreement with the board too. I'm fairly certain you guys have no interest in doing that either. The bed space we're looking at, we're talking about is long-term. We're not talking about we need 140 tomorrow, but we'll probably need 140 in 25 years. And we have to build something that is capable of taking on that capacity for the long term. You know, we spend millions, whether it's in capital investments, people in initiatives across the system, whether it's healthcare, community corrections, the jail, GuideLink. I mean, you know, we have millions we've invested, we continue to do that. And I think we're going to start seeing, even because we're doing these things, I think we're affecting a lot of people. We know we are. And I think we're still going to see the jail population start to climb, like the overall average daily population, because we're affecting what we can, but with growth, with everything else we see these things. I think we're starting to bounce back from the trend we were seeing before COVID. There was a dip after 2015, and it was starting to increase, and then we had COVID. And now I think the trajectory is going to start. I think overall the course kind of continues back in that trajectory it was heading. But the notion that we're gonna, the you know, a new presidential administration and the chaos involved with ICE and the fears it creates, and then you know, conflating that into the jail, I completely reject that. I completely disagree with that.
I know there was a comment over here, sorry, do you want to comment?
I just have a quick comment, I guess, grant that jail within 5 years, what they fill up. So, you know, I strongly discourage building our capacity because some of these are neighbors, brothers, family members, community members. So, just building that our jail population size is going to have detrimental effects to our economy. So across the board, I think.
So we're not doubling. And two, we talk a lot about the average daily population. What we haven't talked about is peak. You know, we have to have enough beds for those peak moments. Last year, I think we had one of our peak days was 119 that were on our total count. That's 30. Well, no, we have 92 beds. We keep around 65 in this one. The rest are housed out of county. But we had 119 on our count at one point. You know, we have to think about peak. This isn't about having beds for the average. We have to think about when are we seeing those peak numbers. That's what we need to have the beds.
What we see across the country is even when a commitment is made in the planning to not contract with ICE, ICE finds a way to take the beds. And what we also see is, I agree that we can't make today's plans off of this current federal administration. However, the current federal administration is our federal administration. And what happened yesterday is not what happens tomorrow. We open ourselves up to vulnerability. 3 months ago, we wouldn't have said we were deporting people to El Salvador. And now we do. We don't actually know that those beds won't get taken. We don't actually know that. We don't know that locally, and we definitely don't know that federally. And I know that we are talking, God help us, we have a different administration. In however many years we are away from that, I try not to think about it. But the reality today is we don't. That is the administration that we have today. If we increase our beds, our peak is 119. We are talking about 140 to 240 bed expansion. ICE will use those beds. Doesn't the needs report
So
to expandable to?
that's if 20 years from now, if we needed more beds, we could add 100 more if we needed it. But let's say 20 years from now, we decide we need to add them, then it's gonna take you years to construct it. You have to build it in a way that you need to increase.
Why would we not approve that when it's needed? Approving it now sets us on a trend to just march towards increased capacity. We are setting
That's
ourselves
not
on a
true.
trend
Like,
for
obviously I completely
higher
disagree.
incarceration.
I think that we can agree to disagree. I think that it's always good to hear from different points of view. I know Leslie had a question.
I do. I have a couple of comments. First of all, thank you for your work. It's valuable, it's needed. A second comment is in response to Allison's experiences from the week. I take those calls daily from people that have gotten involved in the legal system because they have a mental illness. I deal with this constantly. First word of advice is get to the judge, get to the judge, get to the judge. The judge will help you. So, sorry. This is a real thing. I also really don't see the evidence for ICE filling those beds. I don't see anything here. I don't know if it's in that other report that's been emailed to us, but I'd like to see the evidence. Does that really happen in other counties in Iowa? Does that really happen in other places across the state? Because right now you sitting here and telling us is one thing, but having the documentation of it is something very different.
To that point, hold on one second. Sarah and Emmett, they are a national organization, and I would be curious if one of you could speak to that. Are you seeing national trends with this question about ICE in particular?
So I can speak to that a little bit. It's complicated because everything is very new. Obviously, the way that ICE is currently functioning is fundamentally, well, maybe not fundamentally different, but different in very important ways to how it functioned in previous administrations. But what we do see is that there is an effort from ICE. There's the rhetoric coming from the president, and there's an effort from ICE to specifically target local jail beds as a place to put people. Obviously, I completely understand that there are political steps in the way in how that happens, but certainly in communities around the country, best example probably is Houston. There have been increased uses of jail beds for ICE detention, and we expect to see that trend continue. Although we believe that local governments will resist that pressure is coming and has come in communities.
Thank you for that. I know, again, wanted to reiterate that Prison Policy Institute, they're nonpartisan, so I appreciate your perspective. Were there any other questions about ICE or number of beds? And actually, Sarah or Emmett, can you remind me exactly the number in the Shive report for the bed expansion? I know, or maybe the sheriff can remember what the number was, because there was like an up to, and then there was like a if we needed it. Or
Yeah, it was another 100 if we needed them down the road.
so it was 140 and then up to 240.
Correct.
Yes.
Not a question, but I had one more thing to say on this point. I would just like to say that I feel that I don't know what federal agency, that was not specified. And obviously the data is what's going to be best here in that report, because one situation is one situation. But I feel that we saw that on our tour. When we went and toured the jails, the second jail that we toured was extremely large. And while the sheriff said multiple times that he did not believe in incarceration for profit, he also then continued to explain why he felt like, if these people are going to be incarcerated anyway, we might as well be using it to bring money back to our community. And they did have a lot of federal inmates in that jail because they had the space. And that happened. We just took that tour about a month or two ago.
Very,
Very,
but their community supported that jail, and those are different decisions, and those decisions are made at the local level, and our community is very different than Woodbury County. And so I think that's a false comparison, and talking about what we know is a little dangerous in this situation when we're talking about advocacy and belief. That's not what you know, that's your belief.
Well, there is data.
So we want to see the data, we want to see the report. But in Woodbury County, the sheriff did say that, but that was their plan all along, was to have federal beds to make money to pay the taxpayers back. And they voted on it and they decided that's what they wanted to do. So.
Yeah, and I go ahead, yeah.
One of the things I think about with any building is ideally, I like to try to think of myself as a little bit of an environmentalist. I'd like to have buildings last 100 years. And there's a lot of buildings in this community that have lasted 100 years. If you're gonna do that, you have to have at least space where and part of the problem with our current jail is we don't own any land around it where it could expand or be fixed or anything. it doesn't have adequate footings so that it can go up. So like when we built this building and the parking ramp there and trying to make sure that didn't happen, it does have that. We could add a level to this building if we wanted. We could add a level or maybe two to the parking ramp here. But that doesn't mean I plan on ever seeing that happen. I mean, I like the fact that we built it in such a way that somebody can do that somewhere down the road, but I hope it's a long, long ways down the road. So I think there almost are two different conflicting things here. There's what we're planning that's kind of near term future. And then there's long-term future. And I think the two are totally different things. I view them as totally different things. One is you have to just have a little space with the idea that maybe they'll never use it in 100 years. And that's fine with me. If they don't need it, good. But if you don't allow for it, you probably created a problem somewhere down the road. I mean, when I was in high school, 5 people that were on the board of supervisors here screwed this deal up, and it's caused a problem for everybody ever since. I don't want to be the one who does that for somebody 40 some years ago.
I mean, I think that there is a lot of research on the built environment and how it impacts humans. It's just categorically how we build our cities, how we build our county. Like, there's no question as to that. So we have to be very considerate. I do want to note time. Leslie, I'm going to give you, I know you had a
Just
question.
one, I have
And
one
then
more.
I do want to get to the next. 'Cause-
I just have one more point. While I don't like it, the fact is that currently in our Iowa legislature, they are creating a lot more bills and laws that cause more arrests and incarceration to happen, right? They're charging people who have a mental illness if they assault police officers, if they assault people in the hospital. And while I hate that that's happening, and it certainly probably was the only voice trying to fight against that, at the risk of getting some of these organizations to support the bills that I'm working on to increase things for mental health care. The reality is those laws are getting passed. We are going to see more arrests happening, not that any of us like it. And I just want to make that point because it is part of our current reality. I fiercely would love other allies in the state capitol to fight some of those laws and bills. Just
Leslie brings up a good point. There was legislation introduced, and I'm thankful it didn't go anywhere, that wanted to raise the bond schedule for certain, I think like forcible felonies. It's like, I would say staggering amounts for these bond numbers. I'm glad it didn't go anywhere, but with the continued makeup of the legislature, I imagine you'll start seeing more of those things come again. I think one of the things that's helped the jail population over the years is, I always have to ask you for this. Years ago, they reduced the bond schedule. You know, when I started 20 some years ago, the felonies, the bond was $9,750. So OWI thirds was almost a $10,000 bond. Those are significantly less now. And we see a lot less cash bonds. If they could change that next session, and we would be in a worse situation than we are now. And I think we have to think about those things too, and what we're talking about with bed space, because the legislature could go the other way. And all of a sudden bond schedules are back to where they are, or you see more no bond until initial appearance charges, or more mandatory minimums for a lot of things. And they're seeing more people confined in county jail, and we can't keep doing it in this one.
I appreciate the underlying of uncertainty, and I think that is something that we will have to take into consideration. Although I do want to give you final words as you're headed out. I really appreciate your time, and the report will be sent out to everybody, and then they can send questions. You all can send questions, and we can have a follow-up conversation.
I can make sure that it is, or get my info to you in another
would like to.
way.
That
Yeah,
was
yeah,
great.
and my colleagues at PFF as well. I hear the risks. We need the data from the report. There are potential risks for our states increasing incarceration. We see a reality of ICE taking beds. Both things are not real today, but things that do need to be considered. What is real today is we don't need to expand our beds. We need to be thinking about holistic community safety. And I What is most true for me and what I most want to communicate is I want to vote for a bond measure that builds a new, clean, safe jail. The opposition to that, if it is increasing risk, if it is making vulnerable populations more vulnerable, there is no way I personally can vote for that, and no way our community would vote for that. That is what I'm advocating for, is a bond measure that takes that into account.
So are you saying something on the range of state?
Want the number to remain the capacity that we have. I believe that's all the capacity that we need.
Well, it's a tough, the jail was built for 46. It has 92 beds, our operational capacity is 65. And what's our count
I
today,
personally
John?
would not hold you to 43. I think we are talking about the difference between in the 90s and in building out towards a future that allows for 240. That is a massive delta, and it's in that delta that I'm talking about.
Thank you, and thank you for the clarification. I do want to note too, I had sent the report to Paige, also getting some questions about the Shag Battery report. If committee members have not read that, Paige, can you send that out again as well? The original report that was done last year,
Yeah, it's on our, all the reports are on our website too.
Yeah, but just to send them to committee members, because I think some people didn't know that they expanded to 240. And so we definitely need to be on the same page as to what was originally produced in the report, because the PPI is responding to that report. So that would be helpful. Thank you, Paige. And thank you so much, Elizabeth. Really appreciate it. I know we have a little bit of time left. So I do want to get to item C, which is CJCC business. The final draft of the CJCC public survey questions, discussion and possible vote. We have A, survey and mail example, B, subcommittee feedback. And I'm gonna let. I can, somebody, yeah.
I can be a link, sorry.
You guys can just call.
JJ, can I get help on, or actually maybe it's already up. Can I get help on showing the packet on the screen, please? We've been working with CSSI, thank you. As you know, to do a survey, and we established a subcommittee of this group. I don't have to do all the talking. And we've, the subcommittee met 3 times and worked closely with Ethan and Cassidy to compile the questions. So in your packet, you'll see basically the end results where we left off after 3 or 4 revisions of a cover letter that we plan to go to all the people we want to send a survey to, and all the questions in the form that it will approximately look like when we print it. So with that, I want to step out and let the experts step in and kind of just take it from here, describe really what I just mentioned, if you could. We'll get that pulled up here for you in a second.
And your team, you have quite a bit of team here, so if you all want, you can bring a chair up too.
Yes, we can pull here.
Yeah.
So you've all met Cassidy, I think the last time we all met as a full group. Dahita's joined us as well. Dahita is our research design specialist, and she'll be really taking the lead on the analyses of the results when we get that survey data in, putting the data in together in the report for you all to review. So we wanted her to be here in attendance just so she can also hear some of the questions that are being asked, so that we can make sure the report is crafted addressing the answer or the questions that you all have. Aaron hit the note on the head in terms of the process that we took, so I won't belabor that too much. We do have the cover letter. This is just kind of the last draft of the cover letter. One thing in response to the committee and the board was the option for the survey participants to not do the mail version and instead use the QR to take it via their phone. Just adds another mode for people to be able to utilize that. So we've added that in the cover letter. You'll note that the cover letter also includes a Spanish translation so that participants can either call for a mail survey that is translated or again, use the QR code to use the translated version. So I should pause here and just check in if there's any questions or comments about the cover letter that would have been in your packet.
Committee, any questions?
If they do the QR code, they still get a bug.
The buck comes in the mail. That's right. That's right. Yep. That's perfect.
It's very important.
Yeah, we're definitely gonna need to answer that question. Yeah, great.
All right.
So it sounds like we can move on.
Okay, so and then in terms of the development of the survey, how we kind of approach this is we first in the subcommittee use our first meeting to really simply hear from the subcommittee on what types of questions and what's kind of the general topics that they want to do to include. So there we just had an open discussion, compiled that, and then Cassidy and I, after the meeting, took those kind of calls to action and developed some potential items, questions, and reviewed the literature for potential survey scales to be included. Then in the next meeting, we came back to the committee and showed the various options, talked through them, what sounded good, what didn't, and what should we remove, what should we add. And then in the third meeting, we kind of continued that conversation and came to this final draft. The final version, we also did send to the subcommittee via email for review and comments, and we tried to integrate most of them. There was some back and forth, of course, within the subcommittee. So we tried to kind of make sure everyone's voice was acknowledged in the survey. But of course, here today, we can talk about some of these specific sections. I will do if it'd be helpful, I can do a quick overview of the different sections of the survey, and then we can dive into feedback and questions. So the subcommittee kind of elected to open with a simple question about the vote. And now the logic here is most of your voting members, when that referendum gets put in front of them, will have no prior information that's the spirit of the subcommittee's decision, to have that first question about where are you at on a potential vote. And then it moves into questions about knowledge about the current building. Some questions about where you get your source of information and news. Then it moves into discussions about the current conditions of the jail, whether or not you were aware about the conditions, and then how concerning are those conditions to you. After informing them of those components, there's another question about where are your perceptions about the need for a new jail, and then also now knowing this information, where is your vote? There is an opportunity for respondents to explain their position at that time. Then it moves into the subcommittee wanted information about how important the various considerations were regarding the construction of the jail. So they listed some topics, and we put that in that. That's the first. How important are each of the following factors when considering how to vote for the construction of a new sheriff's office and jail building? Things like the cost, the location, design. Moves into a couple of open-ended questions about what information do survey respondents, Johnson County residents want the board to be aware of, what's most important to them, and then shifts more to what I consider as the context types of questions. These questions are more about giving you some information about your respondents and where their current positions are to help you better understand their answers regarding the vote and the conditions and their knowledge about the jail. So questions about perceptions of community safety, questions about the perceptions of the justice system, the purpose of jails, and the importance of conditions inside jails. And then finally, there's a long sheet of demographic questions that I'm happy to review and discuss as well. So that's your general overview. Happy to take any questions or comments. Cassidy wants me to just quickly note that final question is that potential prompt for participating in focus groups. If the committee decides to go forward with doing those focus groups, this would be our mechanism of recruitment for that. Thank you.
Committee? Yeah.
Okay, I have a question. And I'm imagining that you and the committee discussed this, so please feel free to shoot me down, I guess, but question number 6 is problematic for me. Because the jail, we've just gone through these numbers, right? Built for 46, doubled to 92. They're only housing 65, but we've got an average of about 90 in custody. So what number are we talking about here? I mean, I think a person could realistically answer 3 of those and be correct on all 3.
Well, I'll say you're right, and this was discussed by the subcommittee, and I would turn it to the subcommittee, kind of talk through the logic behind what the final decision was on the holding for the typical day.
That was Lisa and Mandy and it was Rachel and Brad, you were on that show. Yeah.
Michelle.
And Bill. And Brad. Yeah,
And
so
Bill.
enjoyed them. Thank you for your service, by the way. Did somebody want to speak to that?
I think we're trying to get at what's the public's general understanding, if any, of the count. And that it's a tough number to pin down, but I think it does give us a baseline understanding or where maybe.
I just wonder if you said 0 to 20, 20 to 100, 100 to 500, because what I find is people really have no idea. I mean, they're not even within this range because their understanding is way off. And so I'm not sure if this tells us much. And I don't know, just throwing that out.
Yeah, if I can speak to that a little bit. So one of the things that was kind of important for this knowledge-based question, series of questions, right, is that this will not be a formal quiz where we'll be giving, right, like the grade or like what was right. So what we'll present to you is it won't be this percent of people had it right. It'll show you how they were all answering, right? So if you see that, 50% answered 40 to 79 and another 40% said 80 to 119. You as your reader, you can say to yourself, okay, about 90% are in that range, right? So despite the fact that both those responses are close to that, you'll still be able to kind of have a general assessment of
What
are they generally.
What's nice about this question is that it really just gets a sense of like, how full do you think it is? Right? You could say 500, or you could say, but is it, like, because capacity wise, they don't really know that, but if you're
Right.
conceptualizing this in your brain and you're saying, oh, this only goes up to 120 or more,
That's
you're
what
probably
I'm
thinking like, oh, what's the
I've
capacity?
literally found
Yeah.
people that thought there were less than 20 people and
Yeah.
people that thought there were 250.
Right. Yeah.
And it's just because they've never been there
Yeah.
and they don't know.
Well, and sometimes people conflate jail with prison,
Well,
too,
that's it.
so.
Well, people think there's more than one jail.
What was that?
Because does that mean the hold in the jail,
Like
like
the-
the hold in the jail and other jail?
Right.
So, I mean, there was a lot of.
And maybe it's not
discussion
that,
on
maybe it's not that important.
Yeah.
Rod, this helps us with our messaging. You want to get, what's the impression right now? So when we're doing the messaging, we can kind of, in a way, address that or answer those questions. That's really what it's for.
Yeah, I guess
It's a
maybe.
perception.
You're just thinking the response options,
Yeah,
maybe a different
I just-
scale.
Yeah, I mean, I guess if they need to learn, they'll learn a little by day.
And we respond back, you're like, you failed. No.
Yeah.
I have number 10, so were you aware of the following issues regarding the current building? Above that, it says in italics, the Board of Supervisors has identified several issues with the building. I find that when people are blowing through surveys, it'd probably be good to restate. The Board of Supervisors have identified several issues with the building. Were you aware of the following issues regarding the current building as like one question? Because without that context, it just like, were you aware of the following issues? Not really, but they don't know that those are the issues, right? That like we've identified those issues. They're not just things that we made up.
So would it be, I think that was certainly,
Just to even double it.
yeah, I was just gonna say,
People
could
just
we
blur.
simply adding, were you aware of the following issues regarding the current building identified by the Board of
Yes,
Supervisors?
yeah, and just something that doubles it up because you're just like trying to answer to get your dollar's worth, Yeah. I really appreciate everybody's work on this. I really think that it gets a lot of, like, hits a lot of places that I think we are gonna really need to know, public perception wise. So thank you for spending the time to put this all together. I know it sounds like there was a lot of deliberation on wording, so language is important.
You remind me of the plan we have here.
Yes, so if we are all comfortable with the survey development, we are planning to be able to finalize tomorrow. And then it takes about 10 business days for printing and assembly, and then data collection will begin toward the end of May, where we'll start mailing those out. And then if we continue to follow this timeline, we expect to be able to provide analysis and reporting, or start to do our reporting at the end of July, and then early August will be when we provide you the initial report.
Are there any other questions or comments for them before they can send this out? do you have any last things that you have for us before launching? Okay. Well, again, thank you all so much for your hard work. I'm very excited this will be getting out and I'm sure it will make, I'm sorry, was there?
I have a question if it's true for the sheriff, and it's just an impression. When I was going through this last night, and trying to put myself in the mindset of somebody who doesn't know how things are. At the last meeting, there was some very impressive information offered about what can be done with additional space, whether it's AA meetings or different medical facilities that were involved where a place where inmates could be taken care of. It was a much safer environment overall for everyone. I worry that it was the same size, and some of this really gives me the feeling that we're trying to influence the public to think small. And I understand the mentality, but I also understand what is taking place when you expand the facility and offer those services to care for the inmates. Just am curious about it.
That you think this influences to think smaller?
I do. I walk away from it feeling, I know how little, because I talk to people, when I talk to city councils, I know how little people feel about the jail. They'll take everything for granted. It goes on 24/7 for all of our law enforcement. And people don't.
Well, I think, Mary, to some of your point, number 15, it really does kind of get to what are some of the important factors, and one of them is space for services and programs. And I think maybe if people are more, interested in that, you have an opportunity to say that. And in terms of the design of the building, size and capacity, like there's opportunities there, I think, for people to comment. And we can get that feedback and use that to determine how we're going to be talking about things. But I appreciate your comment, though. Thank you.
My impression is that we can meet people anyway, want to go.
Well, that is the world that we live
Because
in.
there's so little information and what goes on in law enforcement is so quiet and taking care of a lot of prisoners, but it's kind of.
Yeah.
I know how many sexual assaults take place every month.
Yeah.
I know that they don't go down.
Mhm.
I know domestic violence going up, doesn't go down.
Yeah.
So.
Yeah. Yeah, no, I get that. And I think, I appreciate your comments. I think that some people wouldn't. I'm not gonna go there. Okay. So I think that we have what we need to move forward. It sounds like you all are ready to go, and, the next time we see you will probably be around, I'm sorry, did you say when you'll be coming back?
Likely be early August. That would be pending any decisions. If we want to move forward with the focus groups before then, we might be before then, but otherwise with the survey, it'd be early August.
And you'll be seeing in the survey if people are signing up.
Yeah.
And then you're working with communications to get this out, or?
No.
No,
That's
you're
all
just
their
mailing.
job.
Yeah,
Yeah,
got
they
it.
take
Right.
care of
Deploying it all on our
Yeah.
end. And
Okay.
we will be providing status updates after we hit field to the committee.
Let's get started with the phone part.
The phone follow-ups.
I want to say, mid-June.
That was item 2, discuss the focus groups and proposed timeline updates. Is that what you had just asked?
No, she was asking about the phone
Oh, the
follow-ups. for
phone, I'm
district,
sorry, I
yeah.
heard focus groups. Great. Okay. Item 2 is discuss focus groups and any proposed timeline updates. Did we kind of cover that, though? I don't know.
Just
You said your timeline.
Yep, some clarifying points. So the way we set the contract, because I wasn't sure of the duplicative efforts with this study and then possibly what's going on with the city of Iowa City and Johnson County study, and just didn't want to have that overlap, and maybe we can, and lots of different questions, or yes, we won't overlap. I just thought it was too early, so we didn't commit. But because of the generosity of CSSI, they're there if we need it, and I don't know when that decision is going to be made. Maybe when the joint studies further along and we kind of know that path and that outreach, and then I think we can bring to the table, okay, here's our plan. So not a no, I was just like, I don't know. That's what it was. Yeah.
Yeah,
So thank
okay.
you for that open door. And then maybe in the, midsummer, late summer, we'll know, and then we can turn it on.
Have a
Or
better
not.
And another piece of it that we've talked about is the results of the survey may engender an interest in doing the focus groups among those survey takers as well.
Yeah,
So
we'll read
know
revisit
more.
it.
Great, thank you. Okay, appreciate your work and looking forward to hearing more. Thank you very much. Item D, anything other that we need to discuss? I know we're right a little bit at time. Although our clock are saying different things, it really is only 4:31. Does anybody else have anything else, or we can go ahead and adjourn? Okay, we'll go ahead and adjourn. The next meeting of the Criminal Justice Coordinating Committee is scheduled for June 12th at 3:30 p.m. We are
Thank you.